Good morning. I am Dr. Mohammed On from University Hospital, Waterford. Today I will present our clinical audit entitled Available but Underutilized, Closing the Gap Between Guidelines and Practice, a clinical audit of endotracheal tube cuff pressure monitoring. Endotracheal tube cuff pressure is a simple but important aspect of airway management. Despite the widespread availability of cuff manometers, objective cuff pressure monitoring is not always performed routinely. Our audit evaluated the current practice and identified opportunities to improve patient safety. Excessive cuff pressure may increase the risk of tracheal mucosal injury, sore throat, and hoarseness, whereas underinflation may increase the risk of microaspirations and air leak. Current guidelines recommend ETT cuff pressure to be between 20 to 30 centimeters of water. We conducted a prospective clinical audit of 58 adult patients undergoing general anesthesia with endotracheal intubation. Our primary outcome was the proportion of patients whose cuff pressure was within the recommended target range. We also assessed the availability and utilization of cuff manometers. Our audit demonstrated that only 48.3% of patients had endotracheal tube cuff pressures within the recommended target range. Although cuff manometers were available in 91.4% of theaters, they were used in only 36.2% of cases. Overall, 48.3% of cuff pressures were above the recommended target range, while only 3.4% were below the target range. These findings highlight an important gap between equipment availability and routine clinical practice. Simply having a manometer available does not ensure that objective cuff pressure monitoring is performed consistently. Our findings suggest that routine objective cuff pressure monitoring should become part of standard airway management practice. Increasing routine manometer use represents a simple, inexpensive intervention with the potential to improve patient safety. In conclusion, routine objective endotracheal tube cuff pressure monitoring is a simple, low-cost intervention to improve patient safety. Thank you for your attention and time.